My favorite part of my job is being with the patients, seeing the patients, meeting the patients' families, and being a part of their life and helping them battle this illness is the best part of my job.
Okay, what we have here is the charts for the patients. We have about 30 patients that are here today, and each of these clinicians will see the patient, and there's so many things that we do. We do respiratory testing, we do muscle strength testing. If they need to, neuropsychologists would come by. We have the pulmonologist, the neurologist. If the patient has a wheelchair or equipment issues, we have different vendors here that donate their time to help make repairs or supply equipment. And so they try to fine-tune things for some of our patients that are in from out of town. And we have patients as far as Mexico and Alaska that come to this clinic.
My personal experience with ALS started back in 1993 when Dr. Stanley Appel diagnosed my husband with ALS. He was 37. And it was a shock because he was so young. He was active duty in the military. We went to see Dr. Appel. Everybody told us in the military, they all said, you got to see Dr. Appel in Houston. And so we got that appointment. And Dr. Appel confirmed what we had feared. And so we kind of looked at one another and said, okay, well, he's given us the tools to fight and he's given us the hope that we need, so let's go. And we're gonna make this the best life we can. When my husband was diagnosed, we did decide to have a child, and so my son has been my little shoulder to lean on. He's been a great kid. We still love to talk about Daddy. He still loves to help with ALS fundraisers, so he's still very much part of that area that affected his life. My husband did pass away in 2006 from ALS. He had been on a ventilator, tried it for about 11 months, and it was a very difficult time for him. He made that decision that he was tired, and he said, it is my time. And so I spent about the next year trying to figure out what I wanted to do. My son was 12 or 13 at the time. And so one day I got a phone call from Dr. Appel, and Dr. Appel said, okay, young lady, how are you doing? Oh, I'm doing okay. And he goes, what are you doing right now? And I said, nothing much. And he goes, I want to talk to you about an opportunity. And he asked me, what do you think about being my ALS clinic coordinator? And I looked at him and I said, well, sir, I'm a nurse, but I have no clue, absolutely no clue how to run a clinic. And he goes, young lady, I can teach you how to run a clinic. I can't give you that passion that you have. And so I started almost 2 weeks later, and it has been the absolute perfect fit. He showed me how to run the clinic between him and Joan Appel, his physician assistant and wife. They gave me all the tools I needed to run the clinic. And so I have been working here now for 7 years, and it's been wonderful. It's probably been the greatest job I've ever had.
Hey,
Hello.
she's back. She's getting around on the heels.
Yeah. There you go.
A lot of our patients, they like to stay out in the waiting area. They don't want to miss out because they're all socializing. And you'll see that they're all friends. They stay in touch with one another. So they talk freely amongst each other because this clinic is closed to everybody but ALS patients. And so they feel very open to talk with one another, to talk to the clinicians and so forth.
The patients, I hope, find and feel like they can relate to me because I've gone through this. And it's not just somebody saying, hey, this is what we know. I've had a few tell me, you know, it's good to know that you've been through this, and that's why they feel comfortable talking to me.
Hi, Fig. Hey, how are you? This is clinic.
My son was injured with a car accident. He suffered a traumatic brain injury. The trauma surgeon had come to me and recommended that I take Joe off of life support because they couldn't guarantee the outcome. Dr. Simpson and Dr. Appel came to Joe's bedside to see what was the impetus to make this decision. And the two of them came in and they started looking over him and smiled. And I said, what do you see? What do you see? And they both said, Karen, we see too much brain activity. This is not a conversation you should be having. The trauma surgeon came in and spoke with Dr. Appel and Dr. Simpson, and they both told him, you know, this is what we're seeing. There's just too much higher activity. And, you know, he was trying to say, well, we can't guarantee, and, well, nothing in life is guaranteed.
Now to the other side.
Methodist came through for us when my son got sick. The nurses and the staff were all so sweet to him. My son just loved being here, and they took such great care of him. The ALS team is an amazing team comprised of so many clinicians. We have Dr. Appel, who leads the group, who has never faltered in his quest to find a cure for ALS. He is always working on new ideas with the research, and it's nice to be part of that team. It's nice to work for him and work for that team to make life better for our patients, to find that research cure that we're looking for, and just be part of what I think is cutting-edge research. It's great to be involved, especially as a spouse of a patient. I'm part of it, and it's nice. It's really nice. It's empowering.
Dr. Appel and Dr. Simpson saved my life.
Yes, they did. They saved your life. I like that.